Hello everyone and welcome back. We're going to get started with our very first video lecture, Chapter 1. Chapter 1 gives us sort of an overview of the body systems, helps us to learn some of the directional terms that we're going to need to master anatomy and physiology. Sometimes I joke with my students that this is a mixture of geography and foreign language. Right? Because you have to know where these things are relative to one another, and you have to know how to describe that in directional terminology. So here we go. Let's walk through sort of an overview of the body map of the human body. Of course, we are more or less symmetrical right down this midline. You can see here this white dotted line. And so these are all directional terms that we use to talk about one part of the body relative to another. Medial, meaning toward the midline, and lateral, meaning away from the midline. So your eyes are lateral to your nose, and your nose is medial to your ear. Other, maybe more familiar terms, superior, meaning upward, toward the head. Cephalic is another word that means the same thing. We call those synonyms. And so inferior, meaning down toward the ground, or caudal mean the same thing. Caudal technically meaning toward the tail. But anytime we talk about the body part or organ system, we have to make sure that we put in our imagination our patient's body into this position, standing, arms at the side, palms facing forward. This is called the anatomical position. And so in the anatomical position, we can see that your head is superior to your neck, and your knee is inferior to your hip. Looking at a lateral perspective, we can see anterior and posterior, and these are synonymous terms. Anterior and ventral mean the same thing in human anatomy, and posterior and dorsal mean the same thing. So it gets a bit confusing sometimes. Depending on the body system, we may be more used to or more familiar with the term posterior. In neurology, for example, we tend to use dorsal and ventral, but we'll have an ample opportunity to use these terms as we move along. The other terms that we see, maybe the final terms that we see on this particular image, are proximal and distal. Do you recognize any root words here? Proximal has the same root as the word proximity, and distal, like the word distant. So those are good clues to what they mean. These terms are used when we're talking about the limbs and tubular organs. So in the limbs in particular, we can see here the elbow is closer to the point of attachment than the wrist is. So we can skip most of those words and just say the elbow is proximal to the wrist. Vice versa, because the wrist is further away from the point of attachment relative to the elbow, we would say that the wrist is distal to the elbow. Let's see if you've got it. Looking at the lower extremities, the knee is blank to the hip. Proximal or distal? The knee is distal to the hip. Now that was a bit of an easier one maybe because the hip is the point of attachment. But if we look down here, how about this? The knee is blank to the ankle. You might say superior, and that wouldn't be wrong. But if we're talking about this specific terminology relative to the limb, we would say that the knee is proximal to the ankle. Looking at some other terminology, we can see here anatomy really just means structure, and physiology means the function or the study of the functions of living things. It is not a coincidence, ladies and gentlemen, that your course is called Anatomy and Physiology. Structure and function are always related. Different subtopics of anatomy. Sometimes you'll hear people talk about gross anatomy. Yes, maybe it's icky, but that's not what we mean here. Gross meaning macroscopic, big. You can see it with your own eyes. You don't need a microscope. Regional anatomy, looking at the area by studying it by area, systemic, looking at it system by system, like the urinary system versus the skeletal system, and then surface anatomy. We'll look at that in just a few minutes. Microscopic anatomy would include cytology and histology. Oftentimes, histologists are called pathologists because they're looking for disease processes within the tissue that they're looking at under a microscope. Subtopics of physiology include cellular physiology, neurophysiology, and of course, cardiovascular science, which we will spend quite a bit of time looking at next semester in 202. Subjects that encompass both anatomy and physiology, of course, pathology, looking at how disease works, which is really at the heart of healthcare. Of course, we want to figure out how our patients are sick and how that pathophysiology, that disease process, is working so that we can get them better as quickly as possible. Exercise physiology is, of course, another example. All right, I'm going to move on to the second video if I can figure out how to do this.